So we've got our wonderful little props, and what we want to talk about is the 5 stresses.
So this is massage, manipulations and techniques 2. We're
Two.
actually starting our demonstration of everything. And she said our 5 actual stresses that we can apply to the tissue.
You'll have to read that because I don't have my glasses on.
So we got compression stress.
Compression.
Compression.
All right.
So what does compression, what kind of a stress? So we're talking about what does the application of compression do to our client here?
Yeah, because the method, that's where this one's confusing. The method compression
Yes.
also creates the stress.
The stress. So she's going to be applying compression, but the effect on our client here, it's changing shape in relation to the stress is creating the shape change.
That's right. We ready? This is our client.
Yes.
Okay.
We got our little dinosaur.
All right. So and we did the body mechanics with pressure.
Yes.
Okay, because pressure is modified by the amount of compressive
Force.
Right.
Yeah.
Right. Okay. So ready?
Mm-hmm.
That's not very much.
No. There we have quite a bit.
So what happened to our little guy?
Well, we get essentially a squish.
Yeah.
This part, the ends of the object come closer together.
Makes a donut.
Donut or a more brings the sandwich layers
Yes. Or an inner
closer
tube.
together.
Yeah.
Inner tube.
So let's compress this.
No. You see the same effect. Now, sometimes when we go further with this, people will misconstrue certain things. We have to think that as the compression's occurring, we're seeing the top get closer to the bottom.
Yeah, but something's happened
This
at the
sometimes
ends.
also happens around that. So the compression stress can create other stress around this.
Yeah, this is
So-
going to end up being tension.
So, exactly. This right here is going to be our compression stress.
Yeah.
But there may also be tension stresses occurring around it, or it may even create a bend.
Yep.
So,
Here's another one.
another one.
If I apply a force to this compression and something doesn't hold it still, it's going to move. That's what happens.
Mm-hmm.
But if I stabilize it and hold it still, this is something that is going to be important when we think about stabilizing an area before
Mm-hmm.
we apply the method
Mm-hmm.
to create the stress. Now it has to change shape, just like with this. I'm applying a mechanical force now. I'm using actually a compression to do that. And when I lean on it, because it can't move, then it changes shape. And this is reliable. It's going to get thinner in the middle and it's going to pooch out around the edges.
And as she's reinforcing, if the object we're applying stress to is not stable, it then has a better capacity to move in response to the stress, and it will not change shape as much.
That's right.
The more stable and stagnant the object is, then it has to adapt to the stress
That's
rather
right.
than being able to be moved away by it. So that's where it's so important to stabilize the area or the let's say it's the leg or the arm that we're working on, so that we can very clearly focus what stressor we're applying. If
That's
I'm
right.
applying a compressive stress, I want to be secure and stable, and that compression is going where it's supposed to, and they don't inadvertently move out of the way.
That's right.
Okay.
All right, now what's the next stress?
Now we got our tension stress.
Okay, tension stress is usually applied with a gliding or sometimes we think of it as stretching or elongation.
And that's probably going to be, initially for most people, that's the easier idea, is they think of this tension stress related to the lengthening of something, or the elongation of something.
So if I go to elongate this and using a glide,
Mm-hmm.
and it's not stable, then it's just gonna
Mm-hmm.
roll. But if I hold it still, stabilize it, and I do that, then that happens.
Mm-hmm. And so what you're seeing then, as she does that, go and do that again, is watch. So if she holds here and the glide occurs here, what happens to the tissue in between? It gets longer. Thus, our tension stress. Next we have...
Well, no, let's talk about this
we want
more.
more tension stress. Okay.
All right, so you hold onto the edge of that, like a muscle compartment being attached to a bone around a joint.
Which would be anchoring it.
All right, so you hold it still,
Okay.
and I'm going to do like a traction.
Okay.
All right, ready?
So this would be a pull effect on the
Yep,
tissue.
this is a pull as opposed to a push,
Mhm.
and the ends come apart.
So this could be her, holding on to the lower leg, maybe at the ankle, the calf, and pulling the whole tissue compartment from the ankle all the way up to the
Yep.
hip.
Now, people think that this is changing the tissue.
Mm-hmm.
It's not changing the tissue. Tissue's elastic.
Mm-hmm.
If you go beyond how far this can elongate, then it's going to tear.
Yes. So you don't want to change. The idea that you change tissue permanently is more, that doesn't happen. You want to maybe sometimes return tissue to optimal capacity to change shape. So an example of that is scar tissue.
Yes.
It's too thick. Now you can never get rid of the scar tissue, but you can maybe make the tissue around it more pliable.
That's right.
Again. But you do not permanently change it. An example of some people permanently changing their soft tissue / connect tissues is somebody that stretches aggressively to get more flexibility.
That happens like in some sports or some activities like gymnastics.
Mm-hmm.
You know, and that typically has to occur when they're an adolescent.
Mm-hmm. But over the course of time, what has happened there is actually the ligamental structures have become longer permanently. But we are usually just trying to return tissue
To its normal sliding.
Yes.
Yes. Okay, so compression,
Mm-hmm.
which is a compressive stress.
Mm-hmm.
Elongation, which
Mhm.
can be applied a lot of different ways. Gliding, moving a joint, positioning, traction, makes it longer. This is mostly what we do.
This is where she's indicating that the application, compression, creates the compressive stress.
Right.
Elongation, gliding, which is what we most commonly
Yep.
use, creates a tension
Yeah.
stress.
What's the next one?
Now we're on. Now we have shear.
Ooh.
Shear stress.
Yes, shear is not good usually.
No, at least not done too aggressively. Which
Yeah.
sometimes and oftentimes that's the issue with this. Now, this we would think in terms of a friction. And it's two layers. We want to get one layer sliding against another one. Now, this could be my hand on the skin, or it could be me trying to get a muscle compartment sliding on another adjacent muscle compartment. And that's really a common issue. That's where some of the shear stress has its most benefit, is that we get layers of tissue to effectively slide on one.
Yeah,
But at times, people will work too aggressively on a single area, usually in a small point of
Yeah,
contact.
you get like this. You get to use the point of the elbow, which is a no-no.
Mhm.
And you get in there and you go,
Exactly.
you know.
Now
That's-
there is the technique, deep transverse friction has its place in certain applications. I mentioned scar tissue. There are times when you do use it to potentially damage the tissue, reignite the inflammatory process, but I do, as we were saying, we want to be careful of this one.
And this is usually not creating a shear strain with a friction type move. This is usually not something that we do as part of the general massage. This is what I would categorize as we've done assessment. We realize that something's stuck, not sliding, a little thick, dense. Then we would want to be very cautious and specific, because really what it is doing is creating heat with the friction, and it will create a control re-injury. So don't use this one very often.
No, and like all things optimally, a little bit too little is better than a little bit too much.
Yes.
So introduce the stress to the tissue, and it's a great example of indicating to the client, let's see how your body responds. after the session, if we get a positive result, then we know we can continue and maybe up the duration and intensity.
Another way that you can apply a shear strain is I can hold this and you move it back and
Exactly.
forth.
So this is an example of many muscle energy techniques. She is stabilizing. Maybe she's compressing the tissue. Maybe she's just holding it. And then I, the client, move back and forth.
And that's creating the strain.
Or it could be, really what would be happening is something more like that. If I move this back
Yes.
and forth, we would get more of it would be a bigger effect on the interior tissue.
And that's easier to do too.
Yes, have the client move, and then they have control.
Yes.
So if it's uncomfortable, maybe they can shift in such a way where they're able to adapt and move around a limitation, and that can be a great assessment tool too. Watch the client. Active movements, when we get more into that kind of stuff, the muscle and technique related concepts.
Well,
active movement is a great tool.
the main intervention we teach, which is something that you do after you've done an assessment and think there's a likelihood for a normalization of the tissue, is inhibitory pressure, which is compression, plus movement. Move it.
Which, depending on the movement, can create every variety. A great example of that would be compression, plus having them move the adjacent joint in a circle.
Yep, now you're getting tension, compression, a little shearing, and then what's our next?
And we go right into, then we're to torsion.
Ah.
Now torsion has more to do with what we call kneading, usually. We're going to demonstrate that guy.
Why don't you torsion this client?
So, and we didn't reinforce the whole idea that all applications that we apply are essentially pulls or pushes.
Yep.
Pushes or pulls. So compression is just a push.
Yes.
Tension
is just
traction, where she was, is just a pull. So it can be, let's say they're stabilized. This could be just the pull, and the compression becomes just the push. A torsion is both at the same time. It's harder on our bodies, so we have to be a bit more careful when we do this one, at least when we are introducing with our own bodies both the push and the pull. So a very slow down, simplified concept of this is that I begin just like I would a compression or a glide. So I start with my working hand, and that's a compression, a push, then I hold, and then I introduce the pull.
And there's your twist.
And there's my torsion. I want as much of I don't want just that. The bigger the torsion, the more profound the effect. So usually my push hand, I tell people, get your pull hand further forward. Really make that torsion and twist substantial. This is going to be a better example here of that. But it's a push, pin.
Yep.
That's what I was looking for. Push, pin, then pull.
And here is where the stress is at on the tissue.
Right. You can see, you literally can see where that stress is being introduced.
And it's a combination of elongation as well as some shearing. And you've got compression elements along in that too, along with some bending, which is our last stress. So that's combined loading.
Yes. And the torsion effect tends to have the most profound combined loading.
Yes.
Because you do have alternate A compression, and then I am elongating the distance from where this tissue is to that. I'm pulling this all further away from that.
And so you can't slip.
No, which then also means less lotion.
That's right.
More drag if you're going to accomplish that effect.
Now I use kneading. I use it some for assessment, but it's really more of an intervention.
Yes.
So not as much.
And there's times when I am introducing that stress, but using not both my hands in the way we were demonstrating here. This is what is taught and perceived as kneading. But if we're talking that the benefit of kneading is by introducing a torsion stress, I can also, let's say this is the arm. So here's the bicep area and this is the forearm, and right here is the hinge of the elbow.
Okay.
If I happen to bend the elbow and I'm holding at the wrist and I'm compressing the biceps, and then I just rotate that arm under me, you can see that I'm still getting that torsion.
Plus you're getting some shear and some compression.
And I'm getting that inadvertent joint movement, which is going to be good for the joint capsule. So it's going away from thinking about just the techniques and thinking I don't want to call it mindless rubbing necessarily, but thinking more about what stress does the technique cause in the tissue.
Yeah, and you don't want a knead like this.
Right.
Oh, I see that all the time. That's not doing anything. It's just wasted movement.
Yep. If you're going to do it, and everything, I usually want to get more value for my effort.
Yes.
So I slow it down and I make it bigger. Rather than a lot of this.
The only thing you're getting on there is maybe skin contact,
Which
possibly some shearing.
Yes.
Possibly.
But I make better use of my time.
Yes.
Maybe a little bit of that with the application of lotion. I get much better value for my effort by slowing down and making it bigger.
Yes.
So then we get to bending.
That's it.
Which bending really should just be that.
So,
But we usually achieve that in massage by applying a compressive force. But we can think about where are we in relation to the tissue. I tend to, if I have a choice, I will prefer not to push the muscle tissue too directly into the bone.
right, move it away.
I'd rather kind of try to push it away and not necessarily pull it off the bone, but that's kind of the mindset. So that can be a distinction of, if the bone's directly underneath, am I choosing to come directly down over the tissue and compress it directly into the bone? That will create more of a compression stress. But if I just switch my angle slightly
Yes.
and come more on the side of it, now we'll get this bend effect. Or if I pull,
Yep.
we get more of a bend effect. And it'll usually feel like we're gripping the muscle compartment and pulling it away or toward, but not direct. That's probably the easiest concept. It's moving it away from the bone, not directly into the bone.
Yes, and it's safer that way too.
Mm-hmm.
And so this little bolster here with the ends here, these are mimicking tendons right there.
Mm-hmm.
So if I hold this up a little bit more so the camera's got it, go ahead and push down. That's your compression. But I'm getting this.
You're getting a tension force at the ends.
All right, now
Correct.
do a bend.
Yeah, bend. So that'll be.
That's a bend. Now do one
You're going that way.
Yeah.
So let me go here. See,
So you're using a bend with a pull,
Mm-hmm.
and I'm getting all kinds of strain or stresses into the tissue. Now give it a push.
Let's see if we can get that. But the point is that to recognize that stress in one part
Is going
creates stresses in other areas, peripheral areas. So be mindful of that, and that can be a really important mental leap to be thinking about what stress am I introducing, and then what is the goal
of that.
stress.
So to finish this up, we've got compression, tension. What was the next one?
Oh, shear,
Shear,
torsion, and then a bend.
the end.